Hi everyone, this is Dr. Mrinalini Sharma, and in today's YouTube live session, we're going to be talking about nose jobs, and we're going to be talking about the two techniques of doing a nose job. One is using a filler, which is also known as liquid rhinoplasty, and the other is the traditional rhinoplasty, as we all know. So, in this session, we are going to discuss as to who is a candidate for which nose job, as we've discussed in many of our Insta lives, also in our YouTube sessions, also that it's done to correct a lot of deformities in the nose. So we can do a nose job if you want to, shape the bridge of the nose to narrow the nostrils of the nose. Also, we can do it if you want to lift the nose, or sometimes in order to correct asymmetries. Suppose if a nose is deviated to one side and we want to straighten out the nose, that's also the time when we do a rhinoplasty. So, rhinoplasty is a surgery, and obviously, many patients have apprehensions regarding getting a surgery done. So, in this case, we get this question is very commonly that doctor, do I actually need a rhinoplasty? Yeah, I can go for a non-surgical technique. So people do come and ask me as to doctor, I've heard that this term called liquid rhinoplasty, what exactly does it mean, and whether I'm a candidate for this liquid rhinoplasty or non-surgical rhinoplasty. So today in this session, we're going to discuss as to who is a candidate for a non-surgical rhinoplasty or a liquid rhinoplasty. What are the advantages of getting a nose filler done versus formal rhinoplasty, and what are the disadvantages? So, to begin with, let's talk about the indications where we can simply do a nose filler and avoid a rhinoplasty. Suppose the patient is very scared that no, I don't want to get a surgery done, and he has some issues with the nose. So, let's see what issues can be addressed using fillers. As I said, this term is called liquid rhinoplasty, and what cannot be addressed. So one of the most common problems which can be taken care of using a nasal hum. So बहुत बार क्या होता है कि पेशेंट्स का जो nasal bridge होता है वो smooth नहीं होता, it's not smooth, it's crooked, or there is a bump in the center and उसके ऊपर नीचे dip होता है. So इसको ठीक करने के लिए nose fillers are an excellent option. So what is exactly done is that जहाँ पे आपका hump है, we basically camouflage that hump by putting in a filler just below or just above it. So this creates a nice smooth nasal bridge or a nasal dorsum. So this is one of the most popular indications of getting a liquid rhinoplasty. So the other technique, the surgical technique, obviously would have been to do a rhinoplasty and take down the hump. But as I said, this is one concern which can be addressed using fillers and shows excellent results. The results are immediate, and you can see this change as soon as you come out of my office. So that's one very good indication of getting a nose filler done. The other indication is, suppose your tip is a little depressed. So surgically agar hum usko, if you're using the right technique, if you were to put some filler in the tip of your nose, you can also look a little projected, it can look sharper and a little elongated. However, as I said, these are very specific patients in which putting in a filler would make the tip appear sharper. Usually, what the kind of patients we get in India, especially the skin of the nose is very thick, the tip is bulbous already, and इन पेशेंट्स में फिलर डालने से हो सकता है जो डेफिनेशन है वो ना आए. सो बहुत ही कम ऐसे पेशेंट्स हैं जिनका टिप प्रोजेक्शन जो है या टिप डेफिनेशन जो है वो फिलर डालने से इम्प्रूव किया जा सकता है. सो the main indication, as I said, is correction of the nasal bridge, especially if the patient has a hump. Another thing which can be corrected using a nasal filler is, deviations. So many people will have a crooked nose. You notice that the nasal bridge seems to be tilted to one side. So इसको ठीक करने के लिए भी fillers are a good option. What we are going to do is we are going to be putting in filler on the opposite side. जो side अंदर की तरफ दबी हुई है, we are going to be putting a filler there and basically correcting the deviation. So that's another indication of using a filler to do a rhinoplasty. So the second, as I said, is asymmetry correction. Then, as I said, in some patients, we can also use it for creating some kind of a volume to the tip and giving it a more defined look in a very select subset of patients. Now, let's see what are the advantages. Why do people want this procedure? Number one, as I said, it's a non-surgical procedure. It is not something which has a downtime. इसमें कहीं कोई cut नहीं आता. There are no dressings. The results are immediate, and all we do is to numb the area. We'll be putting a numbing cream in the entire area which is to be treated. The results, as we can see, are instantaneous, and many times we ask our patients to, guide us through the procedure and tell us that if they want something specifically, we can keep taking their inputs and guiding the procedure. So that's one very big advantage of a liquid rhinoplasty. And the other thing is that obviously, as I said, there is no period of swelling, there is no period in which the nose looks really awkward. Thoda bahut bruising, some amount of swelling is there, even in a filler. But it is much less as compared to a surgical rhinoplasty. So if you have an event coming up, if you want your nose to look good in the next, I would say, a week or so, then obviously liquid rhinoplasty is the thing to go for. Especially if your concern is that of a nasal hump or a crooked nose, as I said, and you don't have that much time for a surgery. Or in some conditions, if you have certain, situations, certain health conditions, जिसमें rhinoplasty नहीं की जा सकती, say you are hypertensive, or in the sense those comorbidities are not well controlled. In that case, again, we can think of doing nose fillers as a temporary solution. So basically, as I said, these are a quick solution to problems like a deviated dorsum or a dorsal hump. Now, the let's talk about in which conditions we cannot do a nose filler. We'll have to go for a rhinoplasty. So, the biggest concern, usually, or the most common concern rather, when a patient wants a rhinoplasty is that tip definition nahi hai. The tip is too wide, it's bulbous, it's not pointed, the nostrils are too flared. So, one downside of of thinking of a filler is that this can in no way make your nose appear smaller. So, अगर आपको नाक छोटी करनी है, then obviously the only option is to go for a surgical rhinoplasty. So if you want the nostrils to be narrow, if you want the tip to be more defined, then we have to go for a surgical rhinoplasty. Also, as I said, if you want other corrections, like you have breathing issues, which are like your septum is deviated from inside, that needs to be corrected. That again requires a formal rhinoplasty. Certain other conditions like, the as I would say, the a very fatty tip, or sometimes, as I say, deviations which is also internal. These also cannot be addressed by a liquid rhinoplasty. And if the hump is very big, that's again a condition where I would advise the patient not to go for a filler, because ultimately we'll end up creating a very what you would say, a very heavy and a very prominent nasal which is trying to camouflage the nasal hump, etc. We actually do a formal rhinoplasty and we take down the hump. So that is what is important. Now, the flip downside of getting a rhinoplasty is, as we know, it basically it has a downtime compared to a filler. It has a downtime, and you're going to have a period of nasal swelling. You're going to have a splint on your nose. You're going to have stitches there. So all that will take about a week for the plaster to go off, for the stitches to go off, and later on also the tip swelling actually takes time to subside. So this is not a procedure to consider if you have you have some important social event coming up. So in that case, I would say that okay, if your concern is just a hump, then let's take care of it using a liquid rhinoplasty in the form of using nose fillers. But however, if you think that no, I can basically afford some kind of a downtime and I'm willing to wait for the results, then we can definitely think of doing a formal rhinoplasty, even in cases like a hump, which are to a certain extent manageable by fillers. Now, advantages kya hai? Obviously, as I said, the range of problems which you can address using a formal rhinoplasty is much more than what you can achieve using just a filler. So as I said, you can make the tip smaller, you can make the nostrils narrower, you can straighten the septum of the nose, improve breathing issues, and uh, this can be, and as I said, even a big hump can be taken down by using a formal rhinoplasty. As I said, the only disadvantage is disadvantage is that this will require a healing time. Now, another difference between, the hi Tani, thank you for joining me. Another difference between using a this one filler and doing a formal rhinoplasty is that obviously a filler is a temporary solution. It is not permanent, and fillers will not last you for more than, I would say, maximum of about 2 years. Then they gradually start dissolving because fillers are essentially hyaluronic acid, and this is gradually resolved by the body. It's kind of broken down by the body, so the results which you achieve with a filler are not going to be permanent. So if you want something which is longer lasting, which is permanent, then you should go for a rhinoplasty, as in a surgical rhinoplasty and not just a filler. Now, there are certain important points which you should keep in mind if you're thinking of undergoing fillers. Say, if you think that, okay, doctor, you told me that fine, I can use a filler to kind of smoothen out my dorsum, to hump है उसको ठीक किया जा सकता है. Then, now the second thing is the technique. Now, this is an area, the face is an area where injections can be dangerous if you don't know the anatomy of the region well. आपको ये नहीं पता कि blood vessels कहाँ हैं, क्या कहाँ है, what in areas to avoid, how to make the procedure very safe. This can be dangerous in untrained hands. So even if you're thinking of a liquid rhinoplasty, don't think that just about anybody can do it. Go to a well qualified surgeon who knows the area well, who knows the anatomy well, and who can safely put in the filler. Because putting in a filler, as yeah, Paras, I was talking about the risk only of getting a filler done. So fillers, if they are injected in the wrong areas, like if they are injected close to blood vessels, in fact into a blood vessel, then they can even lead to blindness. So always choose a surgeon or a person who is very well trained with the anatomy of the area, because a surgeon will know precisely where to inject the filler, how to avoid the blood vessels, and we're going to be aspirating with each injection. We're going to be sucking out and saying कोई blood तो नहीं आ रहा, कुछ तो नहीं आ रहा. First of all, we as surgeons are always trained as to know which areas to avoid pricking. We know that okay, यहाँ पे blood vessel है, यहाँ हमने नहीं जाना है. But this is not the kind of knowledge which a so-called, say, a cosmetologist would be like results. Where to put it, how to put it is very important when you use liquid rhinoplasty. So yes, it is less rated compared to surgical rhinoplasty, but that doesn't mean that you should not be knowing the anatomy well, you should not be knowing the precautions well. Again, in the post-op period, like any other filler, you are going to, and we can also do a little bit of touch-up here and there of about a week once all the swelling is subsided, and we can add on whether your problem be taken care of using a liquid rhinoplasty. So if your plastic surgeon says that no, this problem, say as I said, if you have a big nose, no amount of filler can make it smaller. It's basically common sense that if you're going to be adding volume to a big nose, it's simply going to go bigger. So it's not. And again, as I said, indications में अगर ऐसे में आप और filler डाल देंगे तो you just as to whether you're a candidate for a liquid rhinoplasty. Every surgery, if actually you were to see any kind of a surgery, forget rhinoplasty, if you look at what a cesarean section, which is probably the commonest surgery, and probably these days every second or third woman undergoes a cesarean section. Even that's scary, right? So you're going to be cutting the body there also. So scary is, yeah, from a layman's term, every surgery is scary. I won't deny that. But if you look at the safety, rhinoplasty is a very safe procedure simply because, as I said, इसमें कोई blood loss नहीं हो रहा है, इसमें सब कुछ visualize करके किया जा रहा है. So there's no real reason as to be scared of a rhinoplasty. As I said, it has a downtime, it takes a healing process, but it's not something which you should be really scared of. If you have any doubts, if you have any concerns, it's always good to have a detailed discussion with your surgeon that this is the thing which is scaring you, this is the thing you want to be clear about before undergoing the surgery. But once you and your surgeon are on the same page, I don't think there is any big risk associated with the rhinoplasty. In fact, a well-done rhinoplasty will probably improve all aspects, your functional aspects, your breathing aspects, the looks of the nose, everything. Okay, somebody is asking me what is the best option for long-lasting results. As I said, long-lasting results, it's always going to be a surgical rhinoplasty. A non-surgical rhinoplasty is never going to be long-lasting. It's maybe, as I said, if I put in a filler, the maximum it is going to last is about 2 years, not more than that. So if you're looking for a long-lasting result, you have to go in for a surgical rhinoplasty. Now, somebody asked me the cost of rhinoplasty. This is a question which we get asked almost in every Insta live session or every YouTube session, probably. Well, it is very difficult to tell the cost of a surgery without exactly knowing what is the kind of problem you want. Pictures, we can give you an estimation of the cost of rhinoplasty. And yeah, obviously we've had a lot of YouTube sessions on rhinoplasty. We have a lot of videos out there covering various aspects of rhinoplasty. So uh, please go and have a look, subscribe to our channel, and you'll be able to clear a lot of your doubts regarding rhinoplasty. Okay, fillers are safe. As I told you, yeah, fillers are safe if done by a trained person. Fillers are very safe. But as I said, it should be done by a person who knows the anatomy of the region. So it's like driving a car. If you know how to drive a car, that's very safe. If you are a novice and you don't know how to be behind the wheel, it can lead to an accident. So safety is basically based trained who's qualified. So that's the only time when safety becomes an issue, where you go to somebody who does not know the ABC of what is being done. Because as I said, it's not as simple as just putting an injection somewhere and filling it up. Also, there's another aspect to it. I'm not saying that the complication cannot happen in a trained hand. It can. Okay, like any surgery, anything can go wrong. But the thing is, a trained person will now know what to do to reverse the situation and handle it, which will obviously be not the case if you go to an untrained person who has no idea as to now, okay, complication ho gaya, अब इसका क्या करें. Also, the person will not be able to manage. So always go to a well qualified doctor, a plastic surgeon preferably. He or she will know exactly what to put, how to put, how much to put. So all that is important. So yeah, I guess if there are any more questions, I'll be willing to take them. Or else, if you have any further doubts regarding this topic, then you can just put them in the chat box or contact us directly. I'll be more than willing to answer any of your questions regarding both these topics, regarding the surgical rhinoplasty and regarding non-surgical rhinoplasty. And with that, I'll be concluding today's YouTube live, and stay in touch and stay tuned for further updates. Thank you.